people have always kind of seen me, like friends and families, seen me as quite like an self-centered and egoistic. Do you say egotistical person? Yeah. Because that's what I've had to be like to make my life work. Because as an ADHD person, it's like you have to control everything, even like normal things that comes for people, just waking up in the day, making breakfast, packing your bag, leaving. All of that is like on autopilot for other people. But for a person with ADHD, it's like you have to do that manually.
Hello, I'm Dr. Sheri Jacobson, and this is THERAPYLAB, a podcast dedicated to therapy, thought, and the art of mental well-being. In this episode, we are joined by musician Melanie Molhart, aka CRONICLE, to talk about her life and work. Hello, Melanie.
Hello.
Thank you very much for joining us today.
Thanks for having me.
How are you?
I'm good. A little bit tired, but I'm good.
So let's get started. Tell us about yourself.
So I am from Sweden. I am a creative singer, songwriter, performer, and I've been living in the UK about 6 years now, and then a bit back and forth from Sweden to the UK, and then now I'm here just making music.
So in your latest solo ventures as a musician, you go by the name of CRONICLE.
Yes.
What are you working on?
Right now, I am actually working on new material, and as well as moving on with the next single. It's been a few years actually figuring out exactly what my sound is going to be like, and what I want to say as an artist, and all of that. So this year is the first year, although I've been performing with CRONICLE for a few years, this year is the first year I've actually started to release music. And I feel super stoked about the productions, and everything about it right now feels like I've reached my goal and vision with it. And so I have a few singles already ready that I'm going to be releasing next year. And I have a collaboration coming up now in December as well with Norwegian duo and a Finnish producer artist, which I'm super stoked about.
Sounds exciting, and the music business is known for being cutthroat and comes with a lot of challenges, which we can go into. I wonder if we can start off with any early life challenges and the way you first noticed any psychological difficulties.
So I think it was when I was a teenager. When I was younger, obviously you don't have as much responsibility in terms of making your life work, I've been lucky to have a life like that where my parents been super supportive, and they've been, if I forgot anything, they would remind me, and I haven't had to worry about your income and paying bills and stuff like that. So when I was younger, but then in my teenage years, I just and it all kind of becomes more of a reality. Okay, I need to become independent and put my life together and still make sure that I can make music and perform and do all that. It's a completely different story. Because before it was just a passion that I did, and I didn't have to care about, I'm doing this so that I'm getting an income. I'm doing it because I love it, and then people can take it or leave it. But then, so when I was a teenager, I started having days where it was more difficult to get out of bed, and I had a lot of struggles with energy levels. Some days I would feel super excited and super full of energy and on it, and then some days I would just be so tired and don't have energy for anything, and I didn't really think about it in terms of that it would be anxiety or depression or anything like that, but because I was still quite busy. I had my rock band, and my guitarist in the band was very kind of the opposite to me in terms of having structure and focusing and all of that. And I could still be this kind of kid in a way where he would make sure that we are recording here, then we're rehearsing here, then we're going on tour, and then we're emailing these people, and and I just had to perform and be creative and write and then work aside of music, and I still didn't have much time to get lost in my head or have days off where I didn't get out of bed. But so then when my band split up and all of a sudden he was out of my life and the whole structure of my life was gone, I started struggling really hard with that, like really badly. And then I thought it was because of the band being gone, and I was kind of grieving that, and also had a few like rough life experiences where a really close person to me passed away, and also I had been in a relationship for a long time that was gone at the same year. It was all kind of happening within 3 months. So I thought it was like kind of a period of me grieving and being like, you know, oh, why did this happen? And, you know, but
And how old were you at this time?
I was 23, and then moving on and, you know, start working on my own project, and I decided to go do like a university course because of the structure to get, you know, make sure that I had something else that would make me have these like deadlines where I had to write a song for, I had to make this performance happen. But it was really tricky because I ended up in a situation where it was like, I had a lot of experience and I had a lot of skills already, and I wasn't really there to learn more.
And what subject was it?
So I did something called creative musicianship. So it's a mix of songwriting, production, performance, everything. And the course itself was really good, but I think it was just tricky for me because I had already been doing it professionally. And been so busy, and I realized that now I kind of, you know, I was back like 7 years in, you know, in life, and so then start grieving that and even more, and then I also, as an effect to everything, my these like mental issues that I had started kind of have an effect on my body, where I would get so much tension in my muscles, and it would kind of stop my breathing from functioning. So I actually lost my voice for a while I was doing this. And that was obviously because singing has been the thing that's been, you know, freedom for me and my passion and what I love doing. And all of a sudden I didn't have that anymore. So it was even more like, what is going on? And, you know, really, really tough. But then I've been fighting through it all, and I've been actually kind of can look back on everything and be like really proud of all the kind of obstacles I've had in my life, and then still made it to a point where I'm, you know, performing again, I'm writing again, I'm working with people that totally gets me and get my vision, and I'm doing what I want to do. But about a year ago, and I was in a good place, but still struggled so much with, you know, these ups and downs mentally. And I was like, well, you know, I'm living a really healthy life. I'm, you know, eating really well. Don't barely drink alcohol. I exercise. I do my yoga. I do meditation. I've been seeing tons of different therapists, and still, from a day to another, nothing can happen in like circumstances, but one day I'm like amazing and the next day I'm off, like I'm feeling terrible, and I feel like I can barely see like the point of waking up in the morning. And I saw my Swedish like normal GP basically, and I was introduced to the fact that I might have bipolar disorder or have ADHD. So yeah, that was about a year and a half ago. And since then I've been doing this like really long investigation where at first they thought I had bipolar disorder.
And the bipolar, I mean, it fits in the terms of the description of the highs and lows.
Exactly, yeah. And I think that was actually the thing that maybe I had questioned if I was bipolar before, but every time I've read more into it, it didn't fit completely because I've never had these manic episodes. But in terms of either being super happy or super down, that's like totally me, and having like rushing thoughts and stuff like that. But in the end of it, basically, I listened to a podcast and heard another creative person's story and from Stockholm. It's this ADHD podcast on Spotify, and it's in Swedish, and I wish it was in English because it's such a good podcast. And so I don't know if I'm allowed to promote other podcasts here, but yeah. And I heard this woman's story, and it felt on point. Regarding the struggles I've had, I recognized myself so much in her story. And she was diagnosed with bipolar first, and then years later it found out she had ADHD. And once she got the right medication, right treatment, her whole life turned around. So I was so lucky to listen to this before I actually went down the route of, because they wanted to start medicating me for bipolar disorder. And I listened to it right before I was going to start doing that. And I went back to, the healthcare system and said that, I don't want to medicate for bipolar unless I get an ADHD investigation first. Basically, unfortunately, the healthcare, like the normal kind of NHS system in Sweden, there's a really long waiting time. For ADHD, they told me I had to wait 9 months before I got my first appointment, and I had already been investigating this bipolar thing for a year. And as a musician, you have this kind of pressure of, you need to be young and all of that. And obviously, I live for, being productive and ambitious and doing things, and then having someone telling you need to wait for us to help you sort out your mind was just devastating. But then luckily, my parents could come in and help me finance a private investigation. And a month later, I had an ADHD diagnosis. And it's honestly turned my whole life around. Yeah.
Tell us more about the process of getting a diagnosis. How did they find the practitioner? What was the appointment like for you?
Yeah. So again, the private healthcare that I was so lucky to get was incredible compared to the normal kind of healthcare, public healthcare, or whatever you call it. Because when I did that, I had to meet a lot of different doctors, and it was such long waiting time between the sessions, and you don't feel as taken care of. You kind of disappear in the crowd, and it's like they say, in a way, you need to be healthy to be able to be ill. Because there's so much that you need to deal with and be able to push yourself through. And sadly, all I did in the end of it, I just cancelled my last session, and they haven't even got back to me and asked, are you coming back? And I had been for so many sessions with people that are basically saying, you have bipolar disorder. So I could have today been just super depressed and nobody would have known. If I didn't have the support that I have, or lucky enough to do this with a private healthcare investigation, I would have had nobody to help me become healthy, but once I get to do it through this private healthcare practitioner, it's been incredible. It's been so good. They went really fast. I got all my appointments straight away, and a plan structured. This is where we start, then this is going to happen, then we need to speak to your parents, and then we need to because it's a very kind of, they almost are detectives, where they need to kind of dig through your whole life and see where is the red line for ADHD. Can we notice that from when you're younger, and
did they ask for school reports and the like? And
the thing is, what's been tricky for me is the fact that I don't fit into this stereotypical what you think an ADHD person is like, because I've always been really good in school. I've had amazing grades my whole life, and I think the only reason for that is because I've been so lucky to get to express myself with what I love at the same time, and it's given me this focus. So because the first school I went to was, although it was a normal school, we still have a lot of music involved, and we did like theater plays and stuff like that. And after every day, I went to dancing classes or acting classes or singing classes. And so I think for me, I still got to get rid of all this kind of like energy I had inside of me, that I could focus in school and I could be, you know, do really well. And throughout my whole childhood, I was never really like a problematic kid in that way.
So it didn't occur to you or anyone that ADHD...
No, but like my parents were shocked when this came up as like a, you know, a thing, like I might have ADHD, and they went like, there's no way, like you. But then once, you know, they learn more about how different it can be for some people to have ADHD. Like you don't have to have hyper energy. You can have one of the three things, which is like problem with attention, problem with impulsiveness, and hyper energy. If one of these three is big enough of a struggle in your life, you can fall down under the like ADHD roof. But it needs to be enough of it that it's actually considered a disability for you to function in today's society, basically. And all of my problems have never really been a problem for anyone else but myself. So if, you know, like if a normal, let's say like a stereotypical kid who's got ADHD was just, you know, struggle with school, struggle to make their life work and get a job, or, you know, they're just problematic in a way, then the parents might take that kid and go, okay, help us with our kid because there's something, you know, not right here. But I never had that. So I think that's why I've lived my entire life so far, and only a few months ago actually got this diagnosed, because I've had to be the person saying, I can't like make my life function the way other people can. And I don't understand why, because nothing is specifically bad and I'm so healthy and I'm, you know, but it's, once I got the diagnosis, it was just like, 100% this has been the problem all along. And it's also for my parents, I think, a bit of you know, I don't know what you say in English, but like it was nice for them to kind of find out it's not because they haven't been able to help me, or it's not because they haven't, you know, they always been thinking, okay, so why is she feeling like this? Have we done something wrong? Have we not been good enough parents? But they've been incredible parents to me. And now finding out that none of us, or nobody in my, you know, my friends or close people to me, even doctors in the past, therapists in the past, I had no idea that I have ADHD. So now there's an answer to all of my struggles and all of that, which is kind of like nice in a way.
And how do you square the characteristics of ADHD versus what you were experiencing, which sounds more like depression? Was depression something that was spoken about? And
yeah, of course. And, you know, I think in the past I was always kind of trying to almost find explanations for my depressive days. I would never really say that I had depression, because it's usually like for a longer period of time that you have depression. And the only time I can actually go back and say, yeah, I was depressed was when my band split up, because my whole life was just like gone and everything that I worked for was just gone.
So situational rather than underlying.
But then every time, you know, I had these days where I felt so bad and I had so much anxiety and so much like struggled so hard to just get out of bed, or, you know, it was... I try to then find those kind of explanations for that, which is, oh, it's probably because I'm sad over this. It's probably because I'm sad over this. And I would be this person who would not look forward. I would look backwards and go, just like desperately trying to figure out why I was feeling the way I was feeling. And then I would obviously have therapists and people in my surrounding would go, Melanie, there's nothing you can do about the past. Just look forward, like you got such a bright future still. You're still so lucky in all these ways. And I would know that deep inside as well, but it was just this like obviously not knowing about my diagnosis that I've had and this disability I've had my entire life, which was obviously the cause for me to basically have all these ups and downs, because it can be so similar to bipolar disorder in that way.
So you were prescribed medication. Are you happy to say what it was, what it is? Yep.
Yeah, so I'm on Elvance now and Vanlaf vaccine.
Any side effects for you?
I get a little bit shaky, which is, I think, obviously it's worth it, because between my band and once I became, like, I started doing the solo project properly, I became a makeup artist, because I've always been really into, like, doing cool makeup and, looks and stuff like that. So I'm kind of happy that I didn't really go down that path, because then I would have been there, like, not being able to do it properly today. But now I can deal with it. I get shaky. Sometimes there's this like kind of nervousness in me, but it's, you know, the pros from the medication is so worth. Can
you talk about those a little bit? What differences do you notice?
It's honestly like it's a brand new life. I knew that obviously I had struggles before, and that there was some bad things I was dealing with, but now knowing what life can be like now when my brain is functioning the way it functions for like 95% of the population, because of these meds I'm taking, I didn't really have any idea how bad it was before. Because now I can think clearly, I can plan my days. I don't get this kind of OCD behavior where it's like before I used to get a little bit panicked if things weren't perfect. And I think that's like my brain before trying to like control the situation. Kind of like, I don't know how you say in English, but when there's like chaos in your life, your brain have like ways of dealing with that. And for me, it was the fact that I wanted everything to be so perfect. And now I'm just so much more relaxed. I wake up in the morning every day, even though some days I'm more tired. Obviously, it's harder to get out of bed because I've had like a lot to do, or but now I get up, and once I've had my meds, I just get on with things. And I still have bad things that happens. Like a few weeks ago, I found out I have to do like a shoulder operation, which is usually in the past that would set me off for 2 weeks at least, because it would be so killing, like in terms of, oh yeah, I'm in a good place now, I've got all these things, like it's all like this in my life, and there's a structure, and I'm doing things so much, and then all of a sudden I find out, oh shit, I need to do an operation on my shoulder, then it would go bam, and I would be like, get into like a proper depressive episode. And now I was sad for a day, like you get sad because, oh shit, I don't want to do an operation, it's gonna put me off, music and on my sports and stuff that I love doing. But then the next day I woke up and I was like, okay, move on. And that just like never happened before.
Yeah, so pretty transformative.
Incredibly, yeah.
Would like to talk to you now about therapy. What are your experiences of it to date?
I've had a few different experiences. I think for me, it's been the times I've had therapists who are a lot kind of like they want to talk about the past, they want to go through everything, and for me that haven't really done much, because I'm not looking for kind of I think a lot of people need sometimes someone who will listen to them to make them feel better, because I think it's so important that you get to express yourself and you shouldn't hold everything inside. But I'm lucky enough to have friends and my family and also music where I just like put all of that out there. But for me to see a therapist who's kind of going more into that is making me feel even worse than I was doing before. Because I don't really want like a pity party when I'm seeing a therapist. I want someone to give me tools to, develop and move forward. And it's more, for me, it's more about self-development than being like, oh no, this happened. Because I remember there was one time I had a therapist who, went through my current situation, and she was just like, oh, you must be feeling so lonely. And I was like, oh yeah, I haven't even really thought about that, but I do feel lonely. And I'd be like, oh no, I feel lonely,
So drawing your attention to it.
So yeah, and then obviously as well, my therapists in the past haven't known the fact that I've got ADHD. So they've been giving me advice and tools, whatever, for people who are normal functioning in, their brains. And then I've been trying really hard to take on that advice and live after that and do that, but then often failed because it's not the right type of advice for me. So then obviously it would make me feel really shit again, because it's like I just keep on failing all the time. And so now when I have this incredible therapist, or it's my psychiatrist actually is doing all the therapy with me, she's giving me, it's like a new world to me, because she already knows all the struggles I have, because I have this, disability, and she knows how, today's society isn't shaped for people like me, and she knows, the journey that I'm going to be going through now, from getting the diagnosis to getting to know myself in a brand new way, and kind of, getting a new confidence and a new trust in myself. And though everything that she tells me is so spot on, and is so developing, and is so empowering for me, that it's just better than any therapy I've had in the past. Although I think I've had a lot of great therapists as well.
So was she the one who diagnosed you with ADHD?
Yeah.
So she's clearly familiar with it. What are some of the either bits of advice she gives you, or the tools that she works with you on?
She's always going, it's a lot about, going through, the medication. I've been through a few different ones before I ended up with these ones that are now working so well. So she's always making sure that, what are my side effects, how, what dosage am I on, and making sure that that's like in a proper place. And but then also just kind of helping me structure, like, okay, this is what you're dealing with right now. And she already understands what's difficult for me in different sort of like types of situations. And she is just telling me how I should think, what I should focus on. And, she says, I understand that you must be feeling like this right now, because that's how I've always been like, actually in a lot of self-hate, because not understanding what's wrong with me, and always disappointing people, because I've been so easily like forgetting things, easily been late for things. And people have always kind of seen me, like friends and families, seen me as quite like an self-centered and egoistic, do you say egotistical person? Yeah. Because that's what I've had to be like to make my life work. Because as an ADHD person, it's like you have to control everything. Even like normal things that comes for people, just waking up in the day, making breakfast, packing your bag, leaving, all of that is like on autopilot for other people. But for a person with ADHD, it's like you have to do that manually. It's kind of like a mix. It's like you can compare a car that's, with an automatic drive or one with manual drive, but it's even more like my doctor's actually like in an airport where, as a normal kind of, you go on holiday, you go through security, you go sit down by, you have this tower that is controlling all the planes and make sure everything is on time, and if something's still like, they'll sort it out for you. That's like a brain for a normal person that hasn't got ADHD. But a person with ADHD hasn't got that tower. So if a flight is delayed, I need to run out on the like field and make sure that it like still make my life work. So basically they've seen me as quite self-centered and egotistical, and also the fact that I've been so focused on music, which itself is such a, you know, you need to be a bit self-centered to make that work, because it's so much competition, and you really need to be like, put yourself first in that way. But since I've had this, I don't feel like a self-centered or egotistical person, because I care so much about the people around me, and I don't want to disappoint people. And it's been really hurtful for me when I've had that kind of critique. So now when getting this new confidence and understanding that it's not actually been my fault, all these things, it's kind of really, you need to get to know this and become strong in it. And I still, although I have this medication and I get this therapy, it's going to take me a while to get used to not stressing out if I mess up somewhere, or end up in like this self-hate where, oh, you know, I used to feel I'm so lucky, like I'm so privileged in life, you know, with this family, and the fact that I don't ever have to worry about ending up on the street because my parents will have me in their home if I messed up, you know. A lot of people don't have today. And, you know, I get to follow my dream and the music and everything. And it's sometimes when, like in the past, when I've had depressive episodes, it's like, how can I not even make something good out of all of this amazing things in my life, you know? And you end up hating yourself so much for it. So I don't really remember now what the question was, but yeah, so it's been, sorry.
So you've acquired a number of tools and techniques with the aid of the psychiatrist, and also it sounds like you've come to lots of understanding on your own about being kinder on yourself, and also what you need to do to get by in the industry, because it is known for having its difficulties. Let's talk about, to wrap up, self-care strategies, the things that keep you well, and go as wide as you can. I mean, music is obviously a big therapeutic element for you. What do you do to look after yourself and keep you well in amongst all of the challenges you have currently?
I think actually, because I spent so many years trying to figure out what was wrong with me before wanting to take medication for it or anything, you know, doing this medical investigation that I've done, I've spent so much time, you know, trying different diets, trying, you know, meditation, yoga, exercising, so much.
And which do you keep? Which do you practice and engage in regularly?
Honestly, I think I have a bit of everything. I do breathing exercises. I need to, because I still have, unfortunately, as soon as I get into like a stressful period or one day where I'm more anxious than the other, it really affects my breathing, because it's like it's all connected to my diaphragm, like the emotional issue, or like everything that's emotional, it just goes straight into here. And obviously, like, my career is depending on my voice. So it's a really tricky thing to deal with. But I do breathing exercises every day. And I've got a really good routine. I tend to do yoga every day, unless there's been too much going on and you haven't got a chance. But I do at least 10 minutes of yoga in the morning and like about 15, 20 minutes of yoga in the night. I do meditation a bit now and then as well, you know, guided meditation, or I just like listen to a song and I just focus on my breathing. It's kind of goes together with the breathing exercises that I do. I'm still quite strict on what I eat, because that has such a huge effect on like your mental health. I can notice straight away if I've like been eating shit food, like too much sugar, or food with not much nutrition in it. I get tired and like my brain gets foggy. And
So healthy eating, any particular diet or?
Well, I'm totally gluten-free. And a lot of people have different thoughts about, you know, if gluten is bad or good. But for me, it's been very clear, because I used to have a lot of other allergies that I actually, when I tried a gluten-free diet, completely disappeared. I used to get loads of eczema, and I can be close to people wearing too much perfume, because I was really sensitive to perfume. I can wash my hair with shampoo with perfume in it, because I would start bleeding my scalp and stuff. And once I stopped eating gluten, I can wear perfume. I can use creams with perfume in it. I can use normal makeup. So that's like, I feel like it's quite like a proof that gluten has a bad effect on you in that way. I try and stay away from dairy. I try to stick to a pretty vegan diet, although it's quite hard when you need to be gluten-free, because a lot of like fake meat is made out of wheat, which is gluten. But that's more for like kind of environmental issues, like, you know, climate and, you know, not wanting to support the crazy industry, which is the meat and milk and egg industry, because I do love meat, really. But I tend to like treat myself with meat. I see it as a luxury. Like, so when I have meat, I would have it. I know if it's a good thing, like if it's good meat, because I'll have it with my parents. They always buy like organic, you know, that's been hunted down in the forest or like a proper farm, or and so yeah. Other than that, I stick to a lot of fruit, vegetables, nuts, seeds, stuff with a lot of nutrition in it. And yeah, I can tell a massive difference when
I'm smiling
really
just because that's a very appealing diet to me as well. The other thing that appeals to me greatly, which you engage in, is board sports.
Yeah.
Tell us a little about that.
Yeah. I've always, I think in general, I've been a really active person my entire life. And I fell in love with board sports when I was about 11, 12, 13. I started wakeboarding, started skating or longboarding in the start, and then tried surfing when I was 16, and then tried wake surfing. And today, basically, I have this skateboard, like a city cruiser, which is kind of mixed between a longboard and a skateboard. And I bring it with me everywhere I go. Unless it's like snowing or raining outside, I can't really skate. But it's just something that is so, whenever I have a bad day or, you know, something really heavy emotionally happens, my best way of dealing with that is to go out, put really loud music in my ears, music that makes me feel things, and just bomb pills. Because I have to, when I do that, I have to be so focused on what I'm doing, because if I'm not, like, I will fall and hurt myself, or I might even kill myself, you know, from some of this speeds I get up in. And it just makes me super present, which obviously can be quite hard. If you, like, meditation obviously can help you with that, but for me, meditation is quite difficult. It's not something that will, be perfect for everyone, or it's quite hard to, you need to sit still and just like, make your brain focus on the breathing, and you'll think about all these different things. And when something really emotionally happens, you have to like force your brain to not think about that, I think, which is doing something really active. And it can be climbing as well for people who might not be into like board sports. And I think climbing is also a thing that you have to be so focused on what you're doing that it kind of gives you a break mentally from all the crazy thoughts that's going on.
It sounds very exciting, and I'm also really impressed that you've got a really big repertoire for self-care strategies. Parting comments for anyone who's listening or watching who could do with some inspiration on how to look after themselves. Where would they start, and any summary tips that you can give?
Yeah, I mean, totally. I think what was also so easy for me to, like in the ADHD investigation that I was doing, they could already kind of exclude all these things like how I look after myself, and if I'm drinking alcohol or not, or if my sleeping habits, and because I'd already tried all these different things. I tried hypnotherapy, therapy, healing, everything basically. But from obviously having ADHD and still been able to get myself out of depression several times from, it's the things that work the best for me is to, first of all, push myself really hard to exercise. It's so hard when you're in that state where it feels like nothing can pull you out of bed. You have nothing that makes you feel like, okay, I'm gonna get up and do this. You still have to be that person who does that, because nobody's going to do that for you. Unless you're super lucky, you have a friend who comes and just pulls you out of bed and says, now we're going to go running. Running is really great. Running really like fast and like, what do you call it, intervals. It will shock your body and you'll just like, okay, whoa. And you'll feel so much better afterwards. I think exclude everything that's bad for your health, alcohol, bad sleeping routines. If you can get, if you're depressed, you can get yourself out of bed, you can start exercising daily, whether if it's just a long walk or if it's running intervals or if it's lifting weights or if it's skateboarding or climbing or anything, it's so important that you do it daily.
And finding the thing that works for you.
Exactly, yeah. And then along with, making sure that you eat well, sleep well, you look after yourself in terms of, meditating or breathing or treating yourself with like just having an afternoon or a night where you're just going to stay in and watch the best movie that you love or listen to your favorite music. And I think all of these things has saved me every time. Before I actually now luckily had my diagnosis and medication and the right therapy and everything, I've still had the disability and been depressed and been able to get out of depression several times and get into a really good state by looking after myself in this way many, many times. So I know that it works.
Yeah, it's so commendable to hear. And thank you so much for sharing all of your self-care tips and well-being journey.
Oh, thanks.
And we wish you all the best for the future. Thanks for joining us, Melanie.
Thank you. Thanks for having me.
HarleyTherapy.com is here to help you book counseling with qualified professional therapists online or in person at the times and prices that suit you wherever you are worldwide. If this is your first listen to Therapy Lab, do hit subscribe to keep up to date with new episodes. We'll see you next time.